Chair, and thank you all for taking the time to help us understand the needs and experience of young people in complex situations. In particular, your accounts of vulnerable people who age out of state care, who experience household disruption, showing how they're left susceptible to homelessness and poverty. The figure of 1,274 young people aged 18 to 24 officially recorded as homeless for August is shocking. Not only is it a record high number, we know, as you've indicated, that the figure is likely much higher in reality. You've also shown us, I think, that it's largely an invisible group who can fall through the cracks, and services like yours are among the only insights we actually have into this world. So I have a few questions, and if there isn't time to answer them, a written reply I think would be helpful, but just to help inform the committee. In your opening statement and submission, you highlighted the need for key workers to provide support into early adulthood around homelessness prevention, provision and life skills. Could you elaborate on the importance of this support and give an indication, for one, of how many key workers we have, and for two, how many are needed? Secondly, you outline how young people under the age of 25 are still subjected to a lower social welfare rate of €117.70, which compounds their risk of poverty and homelessness. And from my perspective, that lower rate is kind of an ideological one from centre-right government parties, and it's not based on an assessment of that cohort's needs. But could you give us a sense of the importance of ensuring vulnerable young people receive the higher social welfare rate? Thirdly, one of your policy recommendations is the expansion of the capital assistance scheme, both in terms of eligibility and also in terms of ambition. That's a scheme that provides funding for housing for specific categories of housing need, which would include youth homelessness. Could you please outline for the committee the importance of that expansion? And finally, I'm just wondering if you could give us a sense of how these issues manifest regionally. Are there variations between counties or urban and rural settings, that kind of thing? Thank you.
Okay, so I suppose if I've got the questions correctly, correct me if I'm not answering them. So I suppose in terms of key worker, as you know, we have at this stage, as the service has expanded, we would have two. So that, you know, probably with an active caseload up of about 20 each, and then we would have kind of additional support. Obviously, people can need more intense support at different moments in their journey. I think a lot of what happens for young people at the start, there is to be recognised as homeless, to have your medical card, to have your kind of social welfare payment. There's quite a lot of bureaucratic challenges in that, and sometimes it is about being able to take people through that process and to get, you know, to have full access to their entitlements. That's kind of one part. A lot of it can be about helping people who maybe really have difficulties with kind of self-regulation, communication. It's about kind of helping them with those kind of lifestyles and how to keep patient in an NTRAO office, for example, or how to express your needs to a GP. That kind of minutiae can be important, and that's the give and take of kind of social care work. And then there's also that bit about maybe kind of setting some goals and some ambition, and you know, getting those kind of wins. That's all the cut and thrust of the work on a day-to-day basis, how to navigate problems, and that everything isn't lost. And again, when young people don't have support, like badly chosen words, an ill-judged loss of loss of temper, a missed appointment, just can have just such, you know, it's like a game of snakes and ladders, and you've just gone back down the snake again. So again, having somebody to accompany people through that journey.
There's two at the moment, did you say?
We have two kind of two key workers. And then we would have, there's the team, there's 4 on the team altogether, plus Aisling as the manager, and then there would be two people to kind of help with practical tasks. So, because sometimes people need more intense support than at others. So there's flexibility, you know, within it. We wouldn't be working to maybe the same intensity as Housing First, but that's...
Do you need more key workers than that, or does it depend on the kind of...
I think it depends kind of on the numbers that a service is is dealing, is kind of dealing that we have grown. It would have initially, there would have been just one worker in the project, but it has grown. And as I said, our core funding is through Section 10, and we have a contribution from TUSLA also. In terms of the social welfare payment, that was kind of a significant decision that was made in a budget, if I recall properly, maybe around 2010, that was part of the austerity. And I guess the idea, I can see that some of the thinking in that was if young people were still living at home with their parents, that they didn't need to be calling on a full social welfare payment. And that's kind of understandable given the pressures at the time. However, it was made continue to be available at the higher level for young people out of care, but there was a whole other subset within that, and again, that they never formally went into care, they never had that eligibility, but they were completely on their own, and at that time the rate was around the €100. And again, some young people, there can have been, they diagnoses around where they're neurodivergent, issues with mental health. If these have not been picked up, again, if they're over 18, if they weren't in families that ensured this, and unfortunately the burden remains too much with families, if they weren't in families that figured this out pre-18, it's a big challenge to get that figured out, recognised, and sometimes they don't have the coping skills, but they are on this lower rate until they are 25. So there should be a little bit more discretion around the actual needs and the vulnerabilities of young people who are in homeless services.
Just on the social welfare rate, there's two other, there was, as Karen just said, there was a commitment from the department, indeed the minister at the time when those cuts were made, that young people leaving care wouldn't be affected by it. That wasn't what there wasn't was a capacity within the system to identify groups that maybe are a bit harder to identify. So you had it wasn't dealt with. There was a group coming out of care who could be easily identified because they had a care plan. Yeah. Therefore, they could get an increased rate. Sort of, if there was a way to identify the young people who were homeless or who were going to be in homelessness, then they would have. The logic is they would have done the same thing. I think because these young people are just harder to identify and fall between the cracks, they're not getting the increased payment. And the truth is, regardless of your age, if you want to prevent homelessness, people need time and resources, and they need capital, and that's how you stay out of homelessness. And if the state is, providing less to young people who are competing in what is currently an insane market, you're going to see increased homelessness, and particularly when you're talking about vulnerable people. Just on the last point, the CAS for care leavers, when that innovation came in, for me, it has the potential to be an absolute game changer. Young people who go on the housing list are going to be waiting on the housing list currently for years. We know that. CAS for Care Leavers provides an opportunity to build up a stock of housing which are permanent homes for young people who are leaving care, but also, in our view, should be expanded to young people who are maybe in these more difficult situations. If you do that, the number of people who leave care every year is fairly stationary. It's about 500 or 600 young people every year. It's far too many, but lots of young people have very good experience and perhaps don't need that same level of support. If we can build up a stock of housing for these young people, as they transition, as they have the support, they will transition to the next phases of their lives and they will move on from that rented accommodation. They shouldn't be forced to move on, but they will naturally move on. Once we build up a stock, we will have the resources there to provide accommodation for young people who are in difficult situation and for young people leaving care. So it's an absolute game changer if it's properly resourced, if the accommodation is built, and it's provided to the young people that need it. It's
and
I can't speak highly
the eligibility is sort of...
Yeah, we do need to expand the eligibility. That's a really important aspect of it.